MESI ABPI MD tutorials. How to perform a measurement with the MESI ABPI MD. In the following video, learn how to perform an ABI measurement using the MESI ABPI MD, how to place the cuffs correctly, and how to interpret the results. How to perform a measurement with the MESI ABPI MD. For the measurement to be correctly performed, ask the patient to lie in a supine position. The arms must lie relaxed on the bed beside the patient. The MESI ABPI MD device comes with 4 cuffs for all limbs. ABI measurement can be operated with 4 or 3 cuffs. When using 4 cuffs, the MESI ABPI MD uses the Smart Arm algorithm to identify the arm with higher systolic blood pressure, which will be used in the calculation of the ABI. When using only 3 cuffs, the user needs to identify the arm with the higher systolic blood pressure manually. We recommend conducting a 4-cuff Smart Arm detection measurement for maximum accuracy. The instructions for correct cuff placement are clearly marked on each cuff. Make sure to select appropriate cuff size according to the circumference of the patient's limb, using the index marking and the OK area on the cuff. Place the appropriate cuff on the left-right arm and position the cuff 2 centimeters above the elbow joint. Make sure that the arrow-shaped artery marking is in line with the brachial artery. The ankle cuffs should be placed 2 centimeters above medial ankle, with the arrow pointing down towards the inner ankle. If the patient has significant difference in the circumference of the ankle versus the calf, the cuff sides can slightly overlap to ensure perfect fit to the limb. If you need further guidance with the correct cuff placement, click on the info icon on the home screen of the MESI ABPI MD. Please make sure the cuff tubes are straightened and not twisted before you start the measurement. If the patient has an amputated leg or is not compliant for an ABI measurement because of extensive wounds, ABI can be measured only on the patient's left or right leg by deselecting the cuff that cannot be used in the amputation mode on the screen. Instruct the patient to relax and remain quiet. Press the Start button to start the ankle brachial index measurement. When performing the 4-cuff measurement with Smart Arm detection, the measurement is performed in 2 steps. First, the arm cuffs inflate, and then the 3-cuff simultaneous measurement using the higher of the 2 arms follows. During the measurement, current blood pressure and pulse waves are displayed. The progress bar shows the timeline of the ABI measurement. When the bar comes to an end, the measurement of all blood pressure ends and all the cuffs deflate. The results screen follows. The maximum pressure in the cuffs is calculated during the inflation and therefore varies from person to person. The MESI ABPI MD uses a unique 3-cuff simultaneous measurement which provides higher accuracy, reliability, and efficiency. The inflation and deflation of the cuffs is controlled by an algorithm. The blood pressures in both ankles are measured using the plethysmography method, which in addition to its high sensitivity, takes the difference between arm and ankle anatomy into consideration. When the measurement process is completed, the result is displayed on the screen. This consists of 5 different areas: ABI values, left and right ankle brachial index, along with the systolic and diastolic blood pressures of the arm that was used for the calculation. Parameters. Detailed information about the pulse rate, systolic, diastolic, and mean arterial blood pressure, mmHg, on the arms and legs. Waveforms, a detailed view of the measured oscillation and pulse waveform graphs. Comment, if you need to make any remarks about the measurement. Add patient. The device allows you to assign the measurement to an existing patient or create a new patient's profile. This option is not required for a measurement to be performed. All measurements are stored in the archive on the device. MESI ABPI MD has the capacity to store 100 full measurements, including values, parameters, and waveforms. They can be very easily backed up using the MESI Results software. If the patient has severe peripheral artery disease, PAD, the pulse in the ankles is very weak. This means the ABI cannot be accurately calculated. Instead, the device will analyze the pulse waveform and alert the operator that disease might be present by displaying the PAD message. The waveforms always complement the PAD message. You can confirm the result by comparing the difference between the pulse waveform from the ankle with the PAD message and the healthy pulse waveform from the arm. Combining both ABI and the pulse wave recording represents the best practice in evaluating the presence and severity of PAD.